You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of cosmetic dentistry. My first guest is Dr. Andrew Skasko. Dr. Skasko, welcome to the program.
Thanks for having me, Randy. My pleasure.
Now, before we get into today's topic, tell me a little bit about your practice.
Well, my practice name is Elite Dental. It's really what I consider the culmination of a vision that I've had since I was in 7th grade.
7th grade, you said you wanted to be a dentist. You don't look like a dentist, by the way.
You know, everyone tells me that, and they always try and tell me who it is that they think I look like, and a lot of times I don't even know who that person is. But it's not ever anybody good.
Okay.
But it really was a vision of mine, and I really wanted to change people's perception of what dentistry is. So many people are afraid to go to the dentist, and today there's no reason to be afraid to go to the dentist. It is so different, and I really believe that my team and everyone at Elite Dental created an element and atmosphere that people actually enjoy coming to.
Now, I told you, I said I feel like I could spot veneers 20, 30 feet away, and you said they probably weren't one of my patients.
Well, probably not. You know, we really care about what we do, and
so there's an art to it, making it look natural, because when I think of veneers, I think of big horse-looking teeth.
Yeah, and you know what? There are a lot of those walking around out there. I see them myself, and it almost becomes a disease, because you see someone and within seconds I'm diagnosing them and seeing how I can fix them. And you know, a lot of people come up to me and they ask me, what would you do? How can you do this? How can you fix me? And I love it. I'm just intrigued by what we can do. The technology in dentistry is unbelievable. But from an art and science standpoint, it's a blend.
So how much art, how much artistic talent?
You know, I was
70%?
making a joke with you earlier about us both being left-handed, and I said all great dentists are left-handed, which obviously I was joking with that. But I would say 50% is art and 50% science, because it's just like anything else. You need a foundation. So you need to learn the anatomy or the morphology of teeth, which are the shapes and how the teeth come into contact and how they function, and the physiology of the mouth and the musculature and everything that goes together to create a smile. Yes, someone could slap a veneer on a tooth and say, hey, that looks good. But if it falls off the next day because the occlusion or the functional anatomy of the teeth are not correct, then what's the point in even attempting to do it? And I'll tell you, it's unfortunate because I see it and I have to correct it. And it's
you correct a lot of cosmetic dentistry. People don't like their teeth after they have veneers. They end up in your lap.
You know, you'll see some cases.
Does that happen?
It does happen sometimes, and you know, everyone's human. As dentists, everyone's human, and I would never put anyone down for their work. You know, I do unfortunately see some things that could have been done differently, and I do them differently.
Okay.
It's in the eye of the beholder, and many people don't think. They don't really know what they want unless they spend time with someone like me to learn about it.
We're going to go through your process, by the way, because you say the patient plays a role here in what their teeth are going to look like.
They play a huge role. I mean, Randy, I know you've had a few things done which we've spoken about, and you
just
had
on the sides, by the way.
Right, I know. But you had to know about it. You had to be involved. You had to think about if you actually wanted to do that. You had to see a diagnostic wax up, which maybe you saw, I'm not sure, but
they did. Yeah.
I would assume, because that's what we use to make the temporary stents, because it's really like a trial smile. Now, there are things out there called trial smiles, so no pun with that, but it really is. It's a blueprint. Just like you're building a home, you have a blueprint for your smile. And if the patients can't be involved in that, then they don't own the smile. I do. And I don't want to own the smiles. I want to create these smiles for them. Now, I have to spend a lot of time guiding these patients on what maybe my recommendations are for doing thousands of veneers.
Yeah, what makes up a good smile?
Absolutely.
You have to kind of show them. I mean, you're a dentist, obviously. You have a bias. You think the smile is pretty important.
It's the most important thing.
Do you believe that, really?
I really do, because who do you meet that you don't, now, okay, you've interviewed a lot of dentists, but even beyond that, who do you meet that you don't look at their teeth and their smiles? And what does it tell you about that person? A person can light up a room with a smile.
That is true. That is true.
There are people that I'm going to show you today that honestly, when they walk in rooms, they light the room up, and it's just because of
but you don't
their
want
smile.
the teeth walking into the room.
Oh, absolutely.
You see that big
you do.
And by the way, I should say, you know, I try not to endorse the people on my program. Our show airs nationwide. I've seen a lot of dental cases. Excellent stuff. So I want to make sure people stay tuned for your work. But I mean, you say you're changing people's lives. How so?
Well, I mean, let's take, for example, a couple cases that I brought today. And again, I have a broad mixture of cases, some very conservatively, very conservative treatments, and others a lot more comprehensive and
veneers.
pretty
We're talking about
complex.
veneers today.
Well, it's a combination, Randy. You know, a lot of people say, oh, I just got veneers, or oh, I want veneers. And that's just something that happens because someone hasn't taken the time to explain the differences in cosmetic dentistry. Now, veneers are, yes, something that everyone knows to be cosmetic and the best of the best.
Okay.
But in certain cases, you have to blend a combination of restorations to get an ideal result. Some of these cases, which you'll see today, have implants intermixed with them, which I don't do the surgery, I do the rehabilitation, and so I'm kind of the ringleader of that. I do a lot of team-based dentistry, and that's what I'm real proud of that because I really think that that's why we're getting idealized results.